Step-ladder pattern of typhoid fever. In typhoid fever, a step-ladder pattern refers to a gradual increase in body temperature over a few days, with the fever rising in a step-like pattern, rather than suddenly. It's a characteristic sign of typhoid fever, where the temperature initially rises to a higher level. Then it plateaus. Then rises again to another higher level, and so on. This pattern continues until the fever reaches its peak, usually in the second week of illness. Let's discuss the characteristics of this step-ladder pattern fever. Gradual onset. Typhoid fever typically doesn't present with a sudden high fever. Instead, the temperature rises slowly over several days. The fever begins at a lower level and gradually increases over several days. Instead of a sudden spike, the fever increases gradually, with each day's temperature being slightly higher than the previous day. Stepwise progression. The fever doesn't just steadily climb. It may have days where it's higher, followed by days where it's slightly lower, creating a step-like progression. The temperature doesn't spike immediately, instead, it rises in a step-like fashion, with plateaus between the increases. After each increase, the temperature may plateau for a short period before rising again. High temperature in the second week. If left untreated, the fever can reach its peak, 103 to 104 degrees Fahrenheit, in the second week of illness. Plateau. After several days of this stepwise increase, the fever reaches a high point and stays there for a period, typically in the second week of illness. Characteristic sign. This stepwise progression of fever is a key indicator of typhoid fever, especially in the early stages of the illness. Not always present. While this step-ladder pattern is often associated with typhoid, it's not always present in every case. Some sources suggest it's seen in about 12% of cases.